As you all know, Chelsea Clinton recently attacked Bernie Sanders' universal healthcare plan, and Hillary Clinton not only defended her, but doubled down on that same attack. Now, if you know anything about single-payer healthcare, you'll know that this attack is incredibly deceptive, so I really wanted to break it down to show you guys just how bad and misleading this really is.
Senator Sanders wants to dismantle Obamacare, dismantle the CHIP program, dismantle Medicare, dismantle private insurance. Now, the Republicans in Congress have voted against the Affordable Care Act 55 times, right? Not because they want to replace it with something, because they want to get rid of it. So I worry that if we give Republicans democratic permission to do that, we'll go back to an era before we had the Affordable Care Act that will strip millions and millions and millions of people of their health insurance. And Senator Sanders wants to devolve the authority to set up state health insurance programs to individual state governors. Now, maybe if I lived in a place like New Hampshire with your governor, I would feel okay about that. But if I lived in a state that had a Republican governor, particularly a Republican governor who already turned down Medicaid expansion matching funds, I don't think I would be comfortable, right? Because I don't want to live in a country that has an unequal healthcare system again. So I don't want to empower Republican governors to take away Medicaid, to take away health insurance for low-income and middle-income working Americans. And I think very much that's what Senator Sanders' plan would do. So I think we need to protect the Affordable Care Act while we look to actually expand the Affordable Care Act and make health insurance even more affordable and available, not go back to where we were before President Obama's administration. Currently, there's a $19 trillion gap, give or take, between what Senator Sanders has proposed and how he's articulated paying for his proposals. So that, to me, is troubling. I really believe, not only from an equity perspective, that what my mom has articulated in terms of expanding access to affordable college is the right answer. It also gives me greater comfort that she's more able to probably get it done because she's already articulated how she's going to pay for it.
So basically, she makes 4 claims. First, she implies that Bernie Sanders wants to actually take away health insurance by dismantling private insurance, and it will, quote, strip millions and millions and millions of people from their health insurance. Now, second, she states that Sanders actually wants to give authority to state governors, and seeing that they opted out of the Medicaid expansion with matching funds, she thinks that it'll be the same case, and she states, quote, "So I don't want to empower Republican governors to take away health insurance." Now, she also states, we need to make health insurance more affordable and available, not go back to where we were. And finally, her last claim is that there's a $14 trillion gap between what Sanders has proposed and how he will pay for it. So that, to me, is troubling. So let's go through each of these 4 claims and just break them apart. So when it comes to her first claim that universal health care will cause millions and millions and millions of people to lose their insurance, well, that's technically true, but what she's doing is she's valuing health insurance over health care, when health care is actually what we need. So, of course, it's the case that, you don't need private insurance if you have universal health care, because everyone will have health care, but the end is not insurance itself. The end is universal health care. Now, the reason why we want universal health care is because with universal health care, it doesn't matter how much money you make. If you're sick, you actually get treatment. That's the way it's supposed to be. That's what's ethical. That's what's humanistic. But Chelsea Clinton and Hillary Clinton are apparently not in favor of that. They care more about the health insurance industry, and that's because the health insurance industry makes a lot of cash off of our lives. So I think that's incredibly misleading. Now, second, she claims that by putting healthcare in the hands of state governors, well, they would just outright deny healthcare to people. But if you look at the Sanders plan that he introduced in 2013, that's not what happens. Now, Politifact explains why this isn't the case. They state that Sanders' plan requires states to set up the specifics of their healthcare system, though they must meet federal standards for various administrative details. For example, states must identify a single agency to manage the program. If a state does not set up a system, or if they refuse to meet the federal standards, the federal government will step in and run that program. So, of course, that's false. It will not be the case like Obamacare that they can just come in and state, you know what, I'm not going to accept this universal healthcare thing. No, there are federal standards, and if they choose not to abide by those federal standards, the state comes in. So that's a lie right there. Now, when it comes to her third point, she wants health insurance to be more affordable and more available. That's what universal healthcare does. It is universally available, hence the name universal healthcare. Let me kind of spell it out there. It's universal. It doesn't matter if you are black, white, small, tall, rich, poor. Everyone has access to universal healthcare. And if that's the case, it is obviously more available. So she's trying to really paint the picture that universal healthcare is actually going to restrict healthcare for a lot of people. That couldn't be more false. Now, she talks about how private insurance would be more affordable than Sanders' universal healthcare plan, but what she doesn't realize is that that's false. Bernie Sanders' plan would actually save people more money because the cost of private insurance exceeds the cost of whatever tax we would get for universal healthcare. And even Politifact stated that universal healthcare, Bernie Sanders' plan in particular, would save people upwards of $1,000 per year. Now, I already explained why it's cheaper before, so I'll just show you the clip really quick. According to Forbes, the average plan under Obamacare cost each individual about $328 per month. Now, the median wage per person is $26,695 per year, or $2,225 per month. So let's kind of put this in perspective. If you earn $2,225 per month, you're going to be paying about $328 per month under Obamacare. Simple math dictates that that's about 14.7% of your income right there. However, she states that Bernie Sanders would need to tax individuals 9%. And, if I'm using my brain correctly and am applying my simple math skills, well, this dictates that 14.7% is higher than 9%. So by switching to a single payer system and ending the regressive healthcare system, what happens? You have more money in the pockets of everyday Americans. Now, finally, she talks about how Bernie Sanders hasn't discussed how he's going to pay for his policies, but that's also not true. I talked about that before as well. Now, when you think about how much it costs for our current regressive healthcare system, it costs approximately $33 trillion. That's trillion with a T. So they admitted that Bernie Sanders' plan will cost 18 to 20 trillion. So if we end our old regressive system and we switch over to Bernie Sanders' single payer system, what happens? Well, we're now saving 13 to 15 trillion dollars. So not only are you able to fully fund Bernie Sanders' single payer plan by ending regressive healthcare, but you're actually going to have a surplus. So this is a very misleading attack. I mean, she knows what she's doing. She's hoping that voters are naive enough to believe her, but that's not the case. 81% of Democratic voters want universal healthcare. Now, thankfully, PolitiFact got a hold of this and they rated her claim mostly false. Because even though it's the case that what she's saying is technically true, the picture that she's trying to paint is false. I mean, it's not the case that people would lose healthcare. Sure, they may lose their private insurance, but you don't need private insurance if you have healthcare. The point is to get people on healthcare, not get them on a fancy insurance plan that's going to benefit your mom's donors, Chelsea. So this is just ridiculous. I don't know why Hillary is using her daughter to launch this attack on Bernie Sanders. It's not effective. And Hillary Clinton should be ashamed of herself for peddling this type of propaganda.